Dr. Yovino, let's talk about your third category of facial health, skin tightness. I always thought sagging skin was about the skin itself, just getting loose. But you said something before this interview that it's changing the way I think about this. On a scale of 1 to 10, how much of what we call sagging is actually about what's happening underneath the skin versus the skin itself?
Probably a 9 out of 10, if not 10 out of 10. Yeah, 9 out of 10. So as we age, we lose volume in underneath the skin that allows the skin to fall more. We have bony regression of our cheekbones. This area around our nose starts to go in, and our jawline and chin starts to get smaller. So with all of that, and we lose our fat pads, we have things called fat pads around the face, and you start to lose volume within the fat. And so you start to hollow out in the temples, hollow out in the cheeks, around the eyes, and everything starts to fall. And that all contributes to, sagging skin and jowls, like you can see, and the jowls and things like that. So it's all from, facial volume loss as we age. And it's, what people would really want to do is just make sure you maintain your overall volume. And if you've lost volume, that's definitely something that you need to treat. You can't just treat the skin outside skin with like Botox and lasers and this and that, and not treat the underlying volume loss that you've had, because then you're just gonna have deep lines here, or be way too hollowed out back here, or have really like caved in temples. And you're just going to look older from that, just that.
So how would you describe the point at which you can be treating this sagging skin non-surgically, and when does it cross over to it's time for surgery, baby?
Well, that's kind of tough to say. I think this area underneath is very difficult to treat with fillers, and you don't want to be like, like everyone knows the famous photo of Madonna. She's so puffy. Yeah, she's not saggy, but she's so puffy, so that doesn't look good. So there's a fine, if you like where all your landmarks sit currently, then, and your skin is way too like this, or, really saggy, you're not really going to have a choice but to cut the loose skin out. Like, even if I lift up a little bit here, like this is a little bit more youthful of an eye than this side, like this kind of look, like trajectory upward, what, like, say this part isn't able to sag down and it's just a little bit of a lift. I mean, that is a little bit more youthful look than this side is. And if I
Sure.
just kind of do this, like, wow, I look 20 again. No, I'm kidding.
Yeah,
No, I do.
exactly.
But so it all depends on what you want and how youthful you want to look. I mean, no one wants to look like this. Like, that's the old facelift in the past of like, get all I can for the, my money.
Mhm.
So it's a kind of a fine balance. You want to, if you can do things non-surgically and still look great, then continue to do things non-surgically. Continue to do things throughout your youth or throughout your 20s, 30s, 40s, 50s, that increases collagen. And you hit a point where you have to start thinking, how can I increase my collagen and elastin? What have I lost? What can I do to make myself look better? And you have to start, doing those procedures if you want to continue to look naturally young. If you don't care, then, and you quickly want like to get the facelift and get this, get that, you can do that too.
Okay. What do you think about taking collagen, like collagen protein powders? That help or
Supplemental. I mean,
yeah.
I don't do that, but I mean, I don't really have an opinion on that. I mean, if you feel like it makes you look better, take it.
Okay. Yeah. It just
Sometimes I'm also of the philosophy, sometimes the less you put in your body, like as far as pills and things, the better you will be, because polypharmacy is never a good thing. And I know I have a friend and she takes tons of supplements and tons of things. And I don't know anybody that gets sick more than her. So I don't know. Could it be all the stuff that she puts in her body? I don't take any of that. I eat whole foods. I cook for myself. I rarely go out to eat because I'm a little bit of a control freak and want to make sure I know exactly what's in my food. Because time and time again, I'll go to a restaurant. I think I'm eating great. And I come home and my stomach's all bloated and I'm, super like, uncomfortable. And, I don't have a good reaction to the food. And it's like, well, it's obviously something they put in it. Or maybe they're not buying organic, or maybe they're not buying or cleaning the stuff. I mean, I don't know. I don't have control over what the kitchen's doing, or is there too much butter or other things in there, that I don't cook with because I cook with, fresh organic vegetables and things like that. So I don't know.
Polypharmacy.
Yes.
What is that?
That is a medical term that, we use, physicians use all the time. That means a lot of meds. You're taking a lot of medication, different medication. They call it polypharmacy.
Gotcha. I have reduced my supplements. I think I went wild for a while, but yeah.
Yeah. I mean, even my mother recently, she tells me, she just about a year ago started taking vitamin D. And I don't know what made her take that. I don't know if her primary told her to take that or what, but she started taking vitamin D pills. And vitamin D increases your serum calcium. And at 85 years old, she gets an attack of her gallbladder because she's getting calcium deposits, whether it's in your gallbladder or your kidney, And so now, and she all of a sudden had to have her gallbladder out at 85. Oh. So had she not taken the vitamin D, would she be in a different situation? I mean, I think so, probably.
Wow. Well, yeah. And here in Minnesota, we're all told to take vitamin D. Wow. Yeah. And oh my gosh, I know a lot of people with gallbladder issues. Holy moly.
Yeah. And I was just told to take calcium pills because, I just had a bone density and my primary is like, oh, you need to take calcium. And I'm like, oh, great. Here I go.
Uh-oh.
Yeah.
Dr. Yovino was a fine arts major before medical school. She won awards in drawing and painting, and her father is a cardiac surgeon. She brought both of those worlds together into an aesthetics career, the artist's eye and the physician's precision. Dr. Yovino, welcome back to Beauty Seek.
Thank you. Thanks for having me.
Absolutely. It's our pleasure. Hyaluronic acid fillers are perhaps a widely used treatment for volume loss. 1 to 10, how often do you inject hyaluronic acid and fillers to address sagging skin?
I mean, that would be a 10 out of 10 for sure. I use it all the time, every day. That is one of the most popular. Well, number one, the majority of the fillers that I use are purely hyaluronic acid based. There's different cross-linkings from different brands. Ones that are more highly cross-linked tend to last a little bit longer than ones that are not. There are some that, love water, some that don't love water. I tend to shy to the ones that aren't hydrophilic, which means they don't love water. That's more the Jupiter brand and things like that. I don't inject those because there's a lot of swelling that's associated with them, and cyclical swelling, which means like even, months and months and months and months, or even years after you inject those, patients will wake up and say, oh, my lips are puffy or my under eyes are puffy or whatever. But usually by noon, it goes away. I mean, that's what you hear commonly with those kinds of fillers. So and right when you inject them, it's like super puffy. So I don't like to use those. I like to inject, see what you get type of thing. Maybe there's a minimal swelling with each procedure, but not a lot. But most of them are hyaluronic acid. And what I love about that is that it's reversible. So say somebody doesn't like the procedure, which is very, very rare, but it can be reversed. So I think the peace of mind from the patients knowing that it can be reversed is a big thing. But most importantly is, you always think about, well, what's the dangers of doing anything? And the danger of doing a gel hyaluronic acid based filler is that filler gets in a blood vessel. And specifically, it gets into an artery. And when it gets into an artery, it's going to travel down and it's going to get to where the capillary bed is. And it will not be able to cross that capillary bed and get into the venous system. And so what it does is it stays there and it becomes like a clog in a drain. And what ends up happening is that it it builds up. But more importantly, what happens when the blood goes through, normal blood goes through, it gets to the capillary blood and it unloads oxygen. And then it goes back into the venous system and goes back to the heart, to the lungs to get reoxygenated. And then it brings that oxygenated blood back to the tissue. And when you block it right at the capillary bed, that tissue that it's supposed to supply with oxygen doesn't get oxygen. And what happens is that tissue starts to die. And so that's the big worry whenever injecting filler is where are the blood vessels, where are you in the plane, how deep are you being injected, where are the arteries and where do they lie and where you're injecting. And a hyaluronic acid based filler has a reversal agent that everyone should be keeping in their refrigerator who does the injections. That's why there's a big danger of getting injected at someone's home or, these other places that people will do, or a med spa that doesn't have that kind of reversal agent on them, because it can be a difference between having, your tissue afterwards or not having your tissue afterwards. So you see all these necrosed skin or skin that has died after getting that kind of filler. And, that's the big danger. So I love hyaluronic acid based fillers because they can be reversed. Make a long story short.
No, that's so great. So if somebody is newly going in to get fillers, what questions should they ask? It could be probably a new provider, someone they don't know. What safety questions should they ask to try to reduce that risk of necrotic skin, if that's a word?
I would ask, how often have you gotten a vascular occlusion? Have you ever gotten a vascular occlusion? How often have you received one? And do you have the reversal agent on hand here in your office if that were to happen? Those are probably the most important things.
Okay, that makes sense. Sidebar here too. In Minnesota, and I think California, you don't need to be even an RN to give injections these days. Is that true?
There are certain states that, I'm not sure about the RN thing. I know
Okay.
RN and above level are where most patients or most people need, I'm not sure about other states.
Okay.
I know that in certain states, nursing or whatever can inject without physician supervision. And I know that in certain states, estheticians, there's a little crossover where they can puncture their skin. I know in this, do microneedling or something like that. I know in the state of California, you cannot. There's physician assistants and PAs, which are, those are the PAs. I think depending on the state, there are rules and regulations of what each person in different fields can be. But rule of thumb is a nurse practitioner or physician can inject typically with no supervision. I mean, physician, of course, can inject with no supervision. A nurse practitioner can also do that in some states or most states. But anyone below that, I don't know if they, usually they cannot. But I don't know.
Okay.
I could be wrong.
Okay. Yeah. Because I think,
in Minnesota, they can inject without, who can inject specifically?
well, I think it was the last time I was visiting at my clinic, and they had mentioned somebody who was selling, I don't know, some type of injectable, then all of a sudden was injecting, and it was legal in Minnesota. They didn't need to necessarily have a big background in the anatomy. And so I thought that was shocking to me. They probably learned a lot selling the, injectable, but really from what you described, I mean, you need to know a lot about the anatomy to know where to inject.
I would not go to that person personally. I would not at all, because it's not just anybody can inject. Anybody can stick a needle in somebody and squirt the gel out. Anybody can do that. But I think, how do I say this? I think the less education that somebody has, the more likely there are to have complications. And I think not only the complications, but I think the less likely they are to give you natural, beautiful results. There are definitely planes of the field. There are, attachments and things like this, you need to know how deep to go to make it look like you were born with those kind of results. There are different gel makeups. It's not just one hyaluronic acid filler and they're all kind of the same. There's ones that are soft, there's ones that are medium, there's ones that are a little stiffer, and there's ones that are very stiff. And you have to know which one to pick depending on where you're injecting. Are you injecting the chin or jawline where it's supposed to act like bone, or are you injecting in soft tissue like the under eyes that you do not want a very stiff filler, or you're going to see it and make it look terrible. So, and are you injecting a filler that is very hydrophilic and loves water, so you're going to promote swelling to that area? You don't want that in the under eyes. So, there's a lot more that goes into it than just like, oh, I'm just going to go to this person because they're cheap. I mean, be careful what you're buying.
Exactly. Filler isn't just filler. Okay. No, that's
filler's
great.
not just filler. You're not just buying like, the filler and trying to make yourself look good temporarily. Like, they can actually do a ton of harm in you. And it ends up costing you so much more in the long run. Like if you have somebody injecting, an area and you get a vascular occlusion and you lose something, or the worst, so I don't even know if like dead tissue is worse or is blindness worse? But those are the two biggest things that can happen from injection of filler. And I don't know which one of those two is worse. I would say blindness maybe, but yeah.
Yeah. And I was talking to Dr. Nadiri, and he's a rhinoplasty surgeon, and then they do lots of liquid nose jobs. He said 20 some years ago, this wasn't even an issue. And now so many people are doing injections. Who are they? So just be very, very careful.
Yes.
Yeah. Okay. So hyaluronic acid fillers, semi-permanent fillers. That sounds kind of exciting and maybe a little terrifying. 1 to 10, how did they compare results-wise to hyaluronic acid?
So typically the semi-permanent ones are not reversible. So that's one big difference. And a lot of them, though, have a secondary effect, which is that they build collagen and elastin. So there's definitely a place for them and widely used in practice. I love them myself, especially if I am injecting somebody for, say, pan facial loss, which means, say I see somebody, they're 45 years old, they've never gotten filler. And there's many different areas that I scan the face and I'm like, oh, you need it here, you need it there, you need it this place, this place, this. If there's a lot that needs to be treated, then something like Sculptra, Bellafill, Radiesse are very good alternatives. They don't last forever, but they last for years. And that's why they say semi-permanent, because they typically last 2 years or more. And, they're really, really, they add collagen and elastin, and they, even have a nice profound effect on the overlying skin.
Wow. That seems like you might want that over the hyaluronic, but you use hyaluronic more than the semi-permanent. What's your rationale?
Well, hyaluronic acid is going to give you an immediate result. Let's say I'm talking about Sculptra here. Sculptra to me is one of the best, injectables. It is typically done in a series of 3 to restore facial volume. And it is the one thing that I personally feel is a great way to reverse age you. So as time goes on, you're going to see, yourself, but much, and it's supernatural, and people can't tell that somebody's had it. And so it fills the smile lines in, it fills all the volume loss on the, backside, the side of the face, temples, right around here, and also in the mid face. Like, it's great. You can't use it very close to the lips or in the lips or very close to the under eyes. Sculptra is a powder that gets mixed with sterile water and it gets injected and fanned across the face. It is amazing at reverse aging people, but it moves very slowly. So you're going to reverse age over the course of 2 years, but it's going to last about 5 years, and maybe even longer than that. But it is a great reverse ager. Well, some people are like, look, I've got a wedding to go to. I want to look good for the wedding. Like, I can't wait that long, or I can't keep coming back every 6 weeks and be re-injected. I want immediate results. Then you go to the hyaluronic acid,
Yeah.
and you inject them for that.
Amazing. So when you say fan across the face, what does that mean?
Typically there will be like an entry. I love to do an entry site right here. And then I'll use this like 70 millimeter cannula, which is like a catheter. And I'll go in through here and I will start to fan, across here where this is a big area where a depression occurs as we age. And, I like to fan across this area and inject it here. I like to come across here and add volume back into, we call this the malar area or the cheek area. This is the mid cheek or lower cheek. And then it'll fan like this across like this, and then down here like that. Sometimes I'll do an entry point right here and I'll reverse, fan in this way. I like to kind of go in right around here and go across here, because eventually this area starts to kind of, you start to see volume loss in there. And then I'll come and go up into here, like, the medial side of this fold, and inject it in here like that. And then it just slowly reverse ages you. It's great.
Amazing.
Great.
I've been hearing more and more about it. But when
It's
I go,
also used off-label. We call it off-label for other areas of the body. Some people like it as if they don't have enough fat for, say, a Brazilian butt lift. They'll do a lot of a lot of Sculptra in the butt. They'll do it sometimes for the crepiness of the thighs or around the knees or the elbows. Those are definitely places that people still will want, or in the neck. For, now there's like these like horizontal necklines are so popular because everyone's like this with their phone,
yeah.
And so people will get it injected there. Those are like the most common places that people will get it.
Well, what makes it do what it does? Like a little bit different, the science between that and like a hyaluronic acid?
Well, hyaluronic acid is just a gel that occupies space. And you have natural hyaluronic acid in your body, such as in your eyeballs, in your knees, in your skin. You have it there, and it is your hydrator, your main hydrator of the face. And it's in a lot of really good skincare that is used to hydrate. It has 1,000 times the affinity for water than other tissue. So it gets injected into different areas, and it fills the space, but your body does have an enzyme. It's called hyaluronidase, and your body has an enzyme that breaks it down. Just like it breaks down your natural hyaluronic acid, it will break down the filler as well. And so the filler, it just like it says, fills and occupies space. Okay. Sculptra, which is PLLA, poly-L-lactic acid, are these little micro like powder beads that gets mixed with sterile water and gets injected evenly around the face. What happens is over time, your body quickly absorbs all that water, and the little microbeads then stimulates the body to produce new collagen and elastin in that area.
Amazing. I cannot believe that this technology exists and I didn't even know anything about it.
A lot of the dermal threads, the threads that people use in their face is the same technology, but in a thread form.
Okay, that's interesting.
Yeah.
I've tried those. I've never really felt like I had success with those.
Right. And most patients feel the same way you do. Oh. And the barbed ones, which are supposed to help pull everything up, are very painful because of the barbs, and patients don't like them for that. We did carry them for a while in our office, but it's a really hard sell for patients because, it really doesn't do what they thought it would.
Yeah. I tried them right here. Like, what is this area of your body?
Your décolleté.
Décolleté. I think I had a line there, and I was told just don't sleep like this. But they tried to put some threads in it. It was painful. So, I think they just cut
Yeah,
them.
it's painful. It's uncomfortable. The barbs hurt if they're barbed or smooth. They either come in a barbed thread or a smooth thread. The barbed threads are intended to pull and do like a non-surgical facelift, but wasn't necessarily that successful doing that. And the smooth ones are intended to go in areas like here, like where I would have injected Sculptra, to go in the tear trough or things like that. People do it around their belly button to try to add a little bit of volume there, or to add some collagen and elastin for crepiness and things like that. Was it super successful? No. And it's very expensive.
Oh,
So kind of fell out of favor.
okay. Okay, according to the American Society of Plastic Surgeons, and you talked about this earlier, we lose 10 to 12% of our total mid-face fat volume over a single decade in middle age. You mentioned something before this interview that I had genuinely never heard of, a treatment that encourages the body to grow its own fat tissue back. Can you tell us about that?
You're probably talking about Renuva. Renuva is a non-surgical injectable that gets injected underneath the skin. You're probably talking about Renuva. Renuva is a injectable that gets injected underneath the skin that is 40% adipose tissue and 70% dermal matrix. And what happens is your body then absorbs all that matrix and breaks it down, and then it stimulates your body to produce new fat. It needs to be done typically in a series or, repeated over time. There's also Alaclay. That's another one that's, has a higher percentage of fat within each injectable than Renuva. But they're both used to, bring fat in from outside the body or stimulate the body to produce new fat.
Okay, so it's actual fat.
There are some actual cadaver fat cells that they have treated. So your body doesn't react, it's not supposed to react to those fat cells. Sometimes an inflammatory response does occur, but it's great for patients that are very, very thin, but do need fat to make things look smoother, such as they have like Ripley implants, or they want a Brazilian butt lift, but they don't have the fat for it, or they want some rejuvenation of their face or their hands, things like that. It's more of a permanent one, whatever takes and becomes a permanent, amount ends up being like a long-term solution to their problem. But, with these, we call them exogenous things, which are from outside of your body that you put inside your body. Those sometimes aren't, it sounds great, but they're not as effective as you might think they might be. And they do require a lot of retreatment and whatever to try to get you the results that you want. Versus like if you did your own fat transfer, that it ends up, because it's fresh tissue from yourself, it's your own body, it's your own fat, and you're moving it to another location. Chances are whatever sticks to that is going to stay. So that's about a 50% take rate.
Oh, okay. Okay. So it might not even take if you're injecting fat from somewhere else.
Well, your own fat, you always tend up over injecting because that some of those fat cells are going to die within the transfer.
Okay.
And so there's about a 50%, rate of transfer. It could be anywhere from 40 to 60. If you're super healthy, you do hyperbaric oxygen therapy, I don't know, take multivitamins or whatever, your body's super, super healthy and wants to accept that fat, then, there's a very high success rate in accepting that fat. But if your body's like, I don't want to accept it, it can reject all of it too.
Okay. And is the rejection rate higher from cadaver fat?
I would say yes.
Probably. Okay.
Yes.
That makes sense.
For sure.
Okay.
Yeah.
I've heard that RF radio frequency microneedling treatments can tighten without surgery. And I've tried them 1 year here, and then maybe a couple of years later, I think it might have just been microneedling now that I think about it. But I've never really felt like I had profound effects. 1 to 10, how profound can the results be for the right skin type?
I'd say somewhere between 2 and 4.
Really?
Mm-hmm. It's about a 20 to 40% tightening.
Okay.
overall. Yeah. And they're uncomfortable. So depending on the procedure that you're doing, it can be a really uncomfortable procedure. RF microneedling, so the needles are going in. When the needles are in the skin, deep in, then the radio frequency current gets emitted. And so depending on the device and the depth, it can be incredibly painful. We tend to do even sometimes 2 method numbing. We will do nerve blocks. We will do whatever it takes to get the patient comfortable to make it a more successful procedure. And a lot of those procedures are also done in a series of 3. Yeah.
Gotcha. Okay. Okay. So, Dr. Yovino, we've covered tone, texture, tightness. We've gone through 17 various treatments. I think we're all ready. Can you share the treatment plan that can help restore our soft, smooth, and creamy baby skin?
Like, it depends on the person. That's always my start, because it depends on age and multiple different factors. If someone's like, say 30 years old, and they came in and they're like, my skin, I'm not happy with the texture and the color and things like that. I'm going to go towards something like a microneedling for that person to smooth out their skin and make it look more youthful and give them that baby glow, and then set them up on a successful skincare plan with medical grade skincare products, such as ours, Yovino MD Beauty. I would do that for someone that age. If they're older and they're like in their 40s and they have the same kind of complaints, but they do have some laxity, because once you're in your 40s, you're going to get that. And you have some sunspots and things like that, then that person, I might suggest like CO2 laser and then followed with skincare. So whether it's CO2 skin, that, or maybe even a skin peel, throw in a skin peel, because skin peel to me is like kind of dry cleaning your skin. It's not going to necessarily tighten it so much. It's not going to change the texture as much, but it's going to help with all the discoloration. And so that's a really good jump starting, especially, or it's good to follow a certain procedure. So if you do a series of 3 microneedling, it's great to top it all off with a medical grade skin peel, 1 or 2 or a series of medical grade skin peels to get the color perfect, the tone perfect, because milky, clean looking skin always looks better than somebody that has a ton of sunspots. And if you look at like celebrity skin, their skin is usually flawless and beautiful and free of any kind of blemish, any kind of textural issue, or any kind of spottiness.
It's true.
Nice and mhm.
It's true. You developed a skincare line. Can you tell us about that?
So our skincare line is called Yovino MD Beauty. It is a medical grade skincare product where all of our, studies and everything about the skincare that we say in all of our claims are backed up by medical science. So we have kind of something for everybody, something for people that really want to build collagen and elastin. We have serums and growth factors and things for people with sensitive skin, products for people that have dry skin or acne or sunspots, or we've got 2 great sunblocks, one that's tinted and one that's not, that is mineral-based sunblocks that help bounce the rays off your skin rather than absorb it, that's free and clear of the harmful chemicals, free of parabens, free of sulfates, free of formaldehyde, cruelty-free and gluten-free. So for people that have, people have gluten allergy and they're putting products on their skin that contain gluten, and they're like, why is this product not working for me? It's probably could be because of that. So, you want to really look at the products that you're using. Ours are great at transforming the skin from, I guess, outside in. And we have something for everybody. We have even brightening pads. We have daily slough pads. We have, retinols, different strength retinols for people that have sensitive skin, and retinols for people that need their sunspots cleared.
When you say medical grade, what does that mean? We need a prescription for these products, or what does that mean?
Okay. So medical grade typically means that the dosing that's in all the products is at such a high level that typically you would need a prescription for it. So say, our retinols. Our retinols are prescription strength retinols. And you can get them through our office, and they're mixed with other things like niacinamide or vitamin C and E, and the amount in them is at a higher concentration. Or even like the testing that's been done on them. A lot of products that you buy over the counter that you might think is like, oh, it's a great over the counter retinol, or you got it from wherever, the department store, or some people will get it from, say, places, discount stores like, say, TJ Maxx, if they're not going to get it from like pharmacies or things like that. If it's not a prescription that they got from a pharmacy and they're getting a product that says it contains retinol, and those products that have been tested typically contain very little retinol at the 1 year mark. It's broken down. And so it's not very effective. But our products, we know at the 1 year mark, pretty much have the same strength as when it was purchased, or if it was bought at the 0 year mark, right away. And so that contributes to medical grade. It's all the concentrations of, like, for instance, if we have something that has salicylic acid in it, it might be at a 10%, whereas something from this drugstore might be at a 2%. Things like that. It's just much more effective, um, much more effective products that are all research-based and backed by clinical research. And so everything that we say, if we say this thing is going to increase your collagen and elastin by 180% to 190%, it's going to increase your collagen and elastin by 180%.
Wow.
So we have things like that in our line.
Oh, great. So can we buy it online, or do we need to?
Yeah, you can buy it at yovinomdbeauty.com, or that's our website. It can be purchased in the office. You can call us at the office and say, hey, I want to order this, and we can set you up and order it through that, or it can be ordered online.
That sounds like a life's work, a whole skincare line.
It was very rewarding. We started it during COVID, but it's very, very rewarding. And, the patients that are on it have just, said how much it's transformed their skin. I use it every day. I'm in my mid-50s. I feel like it's really helped with the texture of my skin and keeping my fine lines and wrinkles at bay, and making me look hydrated, in the long run. I use what we call our wrinkle erase serum every single morning, and that contains hyaluronic acid. And I, put a drop of the serum on my forehead and each cheek, and I wet my hands and I rub it in with wet hands, which is the key, because it pulls that water from the skin and drives it deep into the skin. And so it always leaves me with like a dewy kind of skin look.
Yeah, you've got great skin.
Thanks.
Well, I'm going to check out those products, and I was going to ask you what your favorite product was, but you told us.
That is my favorite product, if I had to choose one.
Okay, great. We'll put that in our store on Beauty Seek as well, if you don't mind.
Okay, great.
Great. Dr. Yovino, you came to Beauty Seek today with 17 treatment options across tone, texture, and tightness categories of skin health. And you just showed us that the result most women are looking for is not typically found in any one single treatment. I believe I need to think about my face maybe a little more holistically to get the results I truly want to achieve. Thank you for being here with our Beauty Seek community today. You are a gift to every woman and man.
You're welcome.
Yes.
You're welcome.
Yes, we appreciate
And remember, if you're going to spend the money and you're going to do a treatment, whether it's microneedling or whether it's, you always want to protect your investment. You don't want to rush out into the sun and say, oh, my skin's looking great, so now I don't have to wear sunblock, or now I don't have to take care of my skin, or I don't have to use, good quality products. You want to protect your investment with what you do so that you look younger for longer. Mm-hmm. And you don't have to do a ton of stuff. You just have to be strategic at what you choose. That's a big key.
Yeah, exactly. And there's so many options, as we all know. And thank you for breaking down at least 17 of them for us.
Yeah. And there's also a thing of doing too much. You never want to overdo it. If you can look slightly underdone with especially filler, you will look amazing. If you look even a hundredth overdone, you will look terrible. So always shy on the side of being a little bit underdone with whatever you do. You never want to be too done up where you can't move. You have too much fill. You have done too much CO2, too many skin peels, too many this, too many that, and you don't look like normal. If someone can point you out in a crowd and say, ooh, like she did too much lip filler, or she did too much, laser, she did too much this, then you've kind of lost out and you've wasted your money.
And the question you would ask to avoid that as a patient is it more, how long have you been doing this for? Or what, if you had to give a question or two?
It's not really a question. It's more of an observation. Look at the person who's injecting you. Do they look overdone? Do they look like, do you want to look like them? If you don't want to look like them, then I would say run. If you think that they're overdone, the question is, do you self-inject yourself? If they like that look, that is also their aesthetic eye. And if their aesthetic eye is telling you, is screaming to you that they over-inject the lips, that they over-inject the tear troughs, the face, they do too much, then you know that they're going to do the same to you. And so you be careful at who you choose. You can look on their Instagram, you can look on their website, you can look at their before and afters, you can see, like, do they do a nice job with the before and afters? But more importantly, do you know anybody that went to them, and how does that person look? And do you like the results that they have? Because it's not just one person. Everyone has someone in their practice that you try your best to put the brakes on that person, but they keep coming back for more, and they keep saying, I want more, I want more, I want more. And you're like, no, 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 no. And eventually you cut them off. And so they leave you and go to another practice. But look at the majority of the people. If you look at somebody and you're like, wow, you look so great, and you ask them, like, well, who do you go to? And they admit that they get stuff done, and they tell you who they go to, that's probably a good person to go to.
Okay. That makes sense. That makes total sense. Because yes, every once in a while I look at one of the women at the place that I go to, and I'm like, oh, it's kind of like, you're almost looking like a little shape of, I don't know if it's fair to say, like a gorilla and like a little cat. I can't quite figure it out, but
it's funny. I've had patients that I've injected that are definitely well-known, that everybody knows. And then I haven't seen them for, say, a year, and they come back and I'm like, did you get your chin injected? Because it's too witchy to me. And they're like, yeah, well, I mean, I went to so-and-so and they said, since you're here, let me just inject, and then they admit that they cheated on me and went somewhere else. But to me, it's like, woo, like you just crossed over, a line where now you look not like yourself and you look done.
Yeah.
And so I can spot that. I don't know if everybody else can, but I can spot it. It's like a siren on their face to me. I'm just like,
And it's so subtle the way it can happen, because you might be getting, I don't know, a little Botox, and then somehow they're injecting down here, and it's like, well, wait, was that part of the plan? But it was, I have a little bit left over. Why don't we just, put it here? So
yeah.
Thank you so much for being with us today. This has been an amazing education. Beauty seekers, thank you, not just for watching, for being part of a community that believes you deserve proper education so you can make the best aesthetic decisions for you. Every new subscriber is a point of proof to us to stay focused on our mission to bring beauty seekers like me and you aesthetic education from doctors like Sarah Yovino. The more educated we are, the better aesthetic results we like to get. All right.
That's true. And thank you for having me on your show.
Absolutely. It's been a pleasure.
You're welcome.
Younger looking skin may not be just about fillers anymore. Beverly Hills Dr. Andre Berger ranks today's top skin longevity treatments, not just for skin, but also fat, ligaments, muscle, and bone, because he shares the treatment he believes may even help regrow facial bone.